Did you know that 3 out of 4 children have crooked teeth and incorrectly developing jaws? So as parents, we can notice our child's crooked teeth from an early age, sometimes as young as 3. Now, the professional advice has typically been to wait until all the permanent teeth have come through, only to have some of those healthy teeth extracted and braces fitted. But what if we told you there was a more natural way to achieve straighter teeth and well-developed jaws? Well, one company is doing just that and taking a preventative pre-orthodontic approach to setting up children for a life without braces. Amber has more from the Myobrace Pre-Orthodontic Center in Clifton, New Jersey. Let's take a look.
A vast majority of today's children have crooked teeth. But what if you could train your child to have a straighter smile, prevent a crowded mouth, improve their jaw development, breathing, and even sleep? We're on location with the experts to show us how early behavioral training can result in a lifetime of good health habits. This is not your typical dentist's office. It's a Myobrace Pre-Orthodontic Center, and the children who are here are learning an innovative approach to dental care and development.
You guys ready to learn a tongue activity? Okay. Who wants to hit the video screen for me?
Today's lesson is all about the correct tongue resting position.
Did you know there's a spot in your mouth where the tongue should automatically rest whenever you're not eating or speaking?
If your tongue does not fit comfortably in the roof of your mouth, do your best to keep the tip of your tongue on the spot. Eventually, you should be able to comfortably fit the whole tongue in the roof of your mouth.
Modern research has shown that crooked teeth may not be genetic, but rather a result of bad oral habits started in early childhood that prevent proper jaw development, which is why Dr. Chris Farrell decided to take action.
I saw the cause of crooked teeth and orthodontic problems not as hereditary, but because children were not breathing properly, were not swallowing properly, and I decided to do something about it.
He developed the Myobrace system to teach children to avoid the bad oral habits that can affect their dental and facial development. By addressing these behaviors early on, Dr. Farrell says it's possible to avoid braces altogether.
The problem really is children getting crowded teeth because they're not growing correctly. The jaws aren't growing correctly. So by starting early, allowing the jaws to grow properly as nature intended, the teeth come in straight even before braces time.
In the last few decades, practitioners like Dr. Barry Raphael have seen a noticeable increase in crooked teeth and improper jaw development. But he says there are clear signs to look for in your own child.
The most common is an open mouth posture, where during rest a child will have their lips apart. We might see that while they're watching TV or on their iPads. We also look for restless sleep and snoring at night.
Dr. Raphael has been treating his patients with the Myobrace system and says this proactive and modern approach to preventative orthodontics can offer better long-term results.
Traditional orthodontics is excellent at straightening teeth, but everybody knows that after the braces come off, we have to wear retainers and pretty much have to wear them forever if we want the teeth to stay straight. But if we can help the teeth grow in straight from the beginning, then this teeth will be more stable throughout life as well.
And by addressing the root of the problem, Myobrace offers long-term health benefits beyond just a straighter smile.
We know that many of the adults that are suffering from either jaw problems or sleep problems, breathing problems like sleep apnea and so forth, these issues started very early while a child was young. We're trying to stem that by giving the child good health habits so that they can grow up healthy.
The first step is to evaluate the child, looking closely at poor oral habits as well as dental and facial development. Once the assessment is made, a plan is developed and treatment can begin. Myobrace treatment involves wearing a series of oral appliances that correct breathing function and retrain oral habits. These are worn for 1 to 2 hours each day and overnight while sleeping. The second component is the myofunctional exercises known as the Myobrace activities, which assist in stretching and strengthening the tongue, lips, and cheek muscles. Zachary DeGidio has been a patient at this Myobrace Pre-Orthodontic Center for 3 years. When his mother noticed his adult teeth overcrowding his mouth, she wanted to help him avoid the painful extractions she had to undergo as a child.
I had braces as a child, my husband had braces, we had a narrow palate, and back then what they did was they extracted teeth in order for your teeth to fit into the mouth. Now with the Myobrace, it opens up the jaw and all the teeth properly fit into a nice broad, wide smile.
Zachary comes to the Myobrace Center once a month for training on the Myobrace activities and says he looks forward to his visits.
It's kind of exciting because I always have to take a test to see if I can go on to the next stage.
This excitement was exactly what Dr. Farrell was hoping for when he designed the Myobrace system. Each Myobrace Center features art, furniture, and technology to capture a child's attention.
We want them in an environment that doesn't look like an orthodontic office. So we design everything so it's directly communicating with the children via iPads, via nice graphics, and via very child-friendly information.
The process has been amazing. Zach does his daily exercises without a problem. He loves it. He finds them easy to do.
Do you have a favorite exercise?
Yes.
Which one is your favorite?
The tongue clicks.
Can you show us how to do that?
Myobrace to me is the cutting edge of orthodontics. I mean, it is just a tremendous process where you don't need braces. His teeth look tremendous. I mean, they're so straight, and it's just the natural way to straighten teeth these days.
Breathe in, breathe out, pinch your nose, and you can walk.
We can't just go to a child and say, change this habit or change that habit. So the combination of the Myobrace activities, the exercises, and the Myobrace appliances work together to change the children's habits.
Myobrace is now being used in over 100 countries worldwide. So if your child is showing symptoms like breathing with their mouth open, or perhaps they're having restless sleep, Myobrace might just be that natural solution you've been looking for. To find practitioners near you, you can go to myobrace.com, or you can always go to our website, thebalancingAct.com.